Do you have a serious long-term health condition? Then make sure you double your defences this winter with the COVID-19 and flu vaccines. Extra protection is critical, as flu and COVID-19 can make you seriously ill. It's safe to have both vaccines at the same time, so don't delay. Do it now. Double your defences. Get vaccinated, get protected. Go to nhs.uk to find out more.
This is Our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi and welcome to Our People podcast. I'm your host Harry Newhouse and I'm a PR and social media assistant here at the Trust. On today's episode we'll be talking about oral health, and here to discuss this with me are oral health promoters Pauline Wright and Emma Bruce. Welcome to the podcast, Pauline and Emma.
Hello.
Thank you, Harry.
To get things started, Pauline, could you explain what you do on a daily basis as oral health promoters?
Yes, our role entails lots of training, Harry. So we go into various venues across south of Tyne and Wear, and we deliver our mouth care messages, to, it can be carers, it can be school teachers, it can be health professionals like the 0 to 19 team. We'll have a quite a wide range of people that we sort of speak to and train.
And Emma, does your role differ from Pauline's?
No, my role is exactly the same as Pauline's, and that is along with other members of our team. There's 6 of us in total. The other 4 are Melanie, Laura, Amy and Maria. Maria being our oral health promotion manager.
Why did you both want to promote oral health, and how did you get into your roles that you have here at the Trust?
Basically, Harry, our roles have kind of evolved from being a dental nurse to sort of being more on the training side of our job. Again, I trained as a dental nurse, got obviously the qualification, worked in a clinical area for quite a few years, and I guess it's the same with you, Emma.
Yeah, I started off dental nursing after leaving school as well, and back in the day I think the dentist did involve you quite a bit with delivering oral health with the patients in the surgery. These days I think we'll have less time to do that, so it's just been a bit of career progression to be able to go off and do that yourself. Yeah,
and from my point of view, I think if you've got the gift of the gab, as we both have, using that gift in a good way.
I suppose it's passion in what you do as well, so promoting the oral health where, like I say, in surgery, it's the dentist really that's doing that, so we're limited to what we can say to the patients in surgery, but now we're able, with that qualification, to go off out and do that ourselves.
Our target audience is a vast array. We can go in and talk to people who are dependent on drug and alcohol and give those advice about looking after their mouths, as they're going through the various processes. We can talk to health professionals, we can go into schools and talk to the teachers. We can't actually talk to the children because we use the trainer model, and obviously trying to look at the environment in school to make sure that it promotes our good oral health messages.
Yeah.
What made you want to become promoters and sort of leave the nursing side?
I think for me it was just the case of, it was a progression. Well, I could see it as a progression to sort of be in control of your own diary and book your own venues in, obviously following a work plan, but it gave you a little bit more freedom.
I think it makes you feel like you're directly making a difference as well. So, like I say, in surgery you might feel like you wanted to have a bit of input in a particular patient's journey, but you're very limited, where now we're in control of going out and delivering those messages, and it feels very rewarding to see that you might have made a difference in your working day.
So you get into the problem before it's a problem rather than
that's it.
finding the solution when it is
prevention.
A problem.
Yeah.
Brilliant. And why? Well, you've mentioned a few things there, but why is it important to promote oral health and You mentioned a few of your target audience, but especially for the younger audience, why is it so important to promote it?
We spend about £50 million taking, children's teeth out, Harry. So it has a massive impact on our NHS. If we can get the messages over to prevent it happening in the first place, then that's got to be good. If we can get the children from a young age, to sort of regular toothbrushing with a fluoride toothpaste. If we can get them to keep sugars to meal times, if we can also get them to visit the dentist at least, once every 6 months, then that's a good start to their, sort of having good oral health.
And you know how much sugary drinks and foods and snacks are available these days, especially to the teenage groups as well. So
yeah, Prime and all that type of thing.
Sometimes we do have freedom to go to select groups as well, so we might target them, certain groups.
What certain groups would that be?
So it would be like a vulnerable group, like maybe...
We've been to colleges in the past, haven't we? And young mums groups, so able to target the mums of little ones.
So I guess with a baby, you've got like a blank canvas there because they haven't kind of got any teeth.
And you find that the young mums want to do, the best that they can do for maybe the firstborn or the young child,
So it's providing that education for them to know how to...
And it's difficult when they've got so many products, that they can use that would make their life easier. Sometimes they don't realise that those products may have like a lot of sugar, and I guess they're taken in by adverts and all that type of thing. And as young mums, they probably would be sort of open to any kind of any kind of product that's going to make their life a little bit easier. So if we can go in and say, well, did you know that if you boiled up some potatoes and froze it, and you would be making your life a lot easier, plus you'd be keeping the child a little bit healthier as well. So if we can get in there, when the child's very young, that's probably one of our aims.
And where does this service cover? So is it just South Tyneside and Sunderland, and is it mainly in the community?
It is in the community, yes, and we cover
South Tyneside, Sunderland and Gateshead.
3 areas, yes.
Quite a large area. Divided between us all in the team, so it keeps us
very busy.
Keeps us going.
And so what are the main messages that you try and promote? So I presume you've got different messages for like the younger target audience, and you've got for your older target audience it might be stuff like stop smoking and
So with our younger ones, it'll be just the 3 main messages, which would be to start your toothbrushing as early as possible when the first baby tooth comes through, and to use a fluoride toothpaste. What people don't actually know is that we've got no fluoride in the water in South Tyneside, we've got none in Sunderland, and only parts of Gateshead is fluoridated. The parts nearer to Newcastle, they will be fluoridated because they get the water from Newcastle, and Newcastle Council put the fluoride in the water there.
Oh, really?
So we have to sort of educate sort of young parents as to how much fluoride that they actually need, and a baby from sort of 0 to 2 needs 1,000 parts per million, and it will be written on the back of the toothpaste. And 7 would need 1,400 parts per million, and we as adults, we need 1,450 parts per million.
So Emma, what are the most common issues you see within oral health with adults mainly?
So with adults, things like smoking and the vaping, when we're going in.
Well, yeah, the vaping's it dries the mouth out quite a lot, so we are just waiting to hear more research about that. I feel it's still just sugar. I think it's people not knowing what the recommended sugar intake should be. So if you don't know what your recommendation is, you don't know really how much over you're going on a daily basis, because we do carry sugar bags around with us as examples of, did you know that these jelly babies have got 35 teaspoons in? It's always the most shocking one. So 35 teaspoons compared to your 7 teaspoons as an adult that you should have in a day. It's, you're going 5 days over your daily intake in just that one thing.
And I think people think because it's a drink, then it doesn't have any impact on the mouth, but it does. Some of the energy drinks have sort of 14 teaspoonfuls of sugar.
One I find's always shocking is the smoothies. My daughter seems to pick the shop bought smoothies thinking that's just doing good because it's healthy, but actually the one in particular that I've worked out for her, it's got over 20 teaspoons in, so it's got more than an energy drink in. So everyone's always shocked to find those kind of things out.
So when drinking stuff like Coca-Cola, is it always best to have the zero sugar, or what's it replaced with?
So if you have the zero sugar, you have to be careful of the wording of some of them, because they might say zero but it might not mean completely zero sugar. If it was sugar free, it's not so bad, and it wouldn't cause tooth decay if you had it in between your meals. Anything with sugar in should just be consumed as part of a meal. So the safest drinks to have in between would be milk or water. But these zero Cokes, for instance, they'll have sweeteners in. Again, some people don't really like to have sweeteners, but it's just knowing the damage that sugar can do to your teeth and things.
And your hips as well, isn't it? It's not just
having that
teeth.
informed decision, really, isn't it?
And what are the best ways to practice good oral hygiene at home?
So you were mentioning the 3 main messages kind of before. Obviously the first one was brushing twice a day with a fluoride toothpaste, keeping your sugary snacks or drinks to meal times, and regularly visiting a dentist.
And I guess people would think, well, why should we keep sugar for meal times? But our saliva comes into play if we allow it to, because what happens in the mouth is, you'll eat something sugary, the germs will consume that sugar as well and have a little squirt of acid on your teeth. Basically, they have a little wee in your mouth, Harry, and that acid actually can destroy the teeth. But if we allow our saliva, the saliva will dilute, it will wash around the mouth, and eventually it will replace the minerals. It takes 3 hours for that process to happen, the remineralisation process. So if we can keep sugar to meal times, that will allow our saliva to repair in between. So it's a good thing.
Mm-hmm.
With the older people, they might be on medications that make the saliva non-existent in some cases, so they have to rely on artificial saliva. That's not recycled, mind, it's artificial, and they get mouth gels and things to help as well. Artificial is obviously they make it in the lab and they have the right
the enzymes
in. And
so it's like some people, I know when you say if they have dry mouth, they'll take a bottle of water around with them, but it just doesn't have that same effect as what it would if you were using artificial saliva because of the enzymes and stuff. But in that instance, I think somebody with a dry mouth would need a higher prescription toothpaste off a dentist. So instead of the 1,450 parts per million fluoride, they'd probably get the one that's 2,800 or 5,000 parts per million, just to protect the teeth that the saliva's not there doing.
So an older person as well, they might have quite a high sugar diet. If they're in a care home, they might have
and
their breakfast,
dry mouth,
and a dry mouth on top of it. So they might benefit as well from having fluoride varnish applied
more regularly.
More regularly.
Maybe every 3 months.
Mm-hmm. And that would be a big amount. That would be about 22,000.
Actually, that's something that we're going to be piloting.
Oh, really?
Right now, actually, starting from September, we were applying fluoride varnish to
older people.
Yeah.
Oh, brilliant. Well,
just to see what kind of an impact that will have on protecting the teeth.
We'll have to have another podcast when the results are out for that.
Yes.
But can bad oral health have a wider impact on your overall health?
Yes, it can.
Definitely can.
They're doing lots of research into that. And obviously we know the 4 obvious things, bad breath, tooth loss, gum disease and the likes. It's also related to Alzheimer's and dementia, strokes, heart disease, lung conditions such as aspirational pneumonia and things like that, oral cancer.
If you can sort of, if your mouth is not cared for and you've got
Infection.
gums that bleed, infection, you're swallowing all of that infection and it's going, to all
Into your
parts of your
bloodstream
body.
and things,
And there's a direct link between, diabetes. If you don't look after your teeth, it has a direct impact on the sugar
levels.
level. And if your sugar level's up, it has a direct contact to the gums as well. So it's like a vicious circle sometimes. So yes, it does have a massive impact on general health. We say that you can't have a healthy body without having, a healthy mouth as well. Just when we go in and talk to carers, we try and make the emphasis on, sort of
incorporate it into the daily routine, just like you would showering and the rest of it.
And you'll be surprised how often it doesn't happen, and how many times, we'll go into a care home and say, look, we are trying to get twice a day routine, and they'll say, well, we haven't got time for that.
Well, actually, I mean, it does become difficult for them because a lot of the residents won't open the mouth if they've got dementia and things, because obviously they're not sure what it's all about and what they're doing. Maybe they've got painful gums as well, so there's all these limiting factors that are preventing it. But we have a couple of little things that we can ask them to do. So there's a toothpaste called Oral Nurse, and it's got no flavour, so it takes away that minty taste. And it doesn't foam as well, so that's a good couple of things that I think would prevent them having oral health delivered for them. And we always say if you're having difficulty with toothbrushing, the first thing you should change is the toothpaste before you try and change the toothbrush. But then also if you're having trouble still, there's a toothbrush, it's called a 3-sided toothbrush, so it does cover all 3 sides of the tooth at once. So it does cut toothbrushing time down to only a third. So if somebody's not letting you in for long enough, so you're not able to spend the whole 2 minutes, that toothpaste along with that kind of a toothbrush is going to really benefit.
Yeah.
And where can somebody get these?
Well, unfortunately, they're not in the supermarkets. They're only online. So we do have links that we send them to, but Amazon's usually a good one. Yeah. So Amazon, you can get them the more you buy. I think.
If they search it online.
Yeah, you'd find it. Yeah, 3-sided. And
so it only has to be in the mouth a third of the time, and quite often they say, we can't get in because they've got a strong tongue thrust or something like that. Well, that just pushes the tongue out of the way. So
attractive for them.
Yeah, so it makes it a lot easier and time.
But that toothpaste would also be good for a lot of maybe autistic children who don't like the minty. There's lots of children that just don't like minty toothpaste. They say it's spicy. But so that Oral Nurse, it's beneficial to a lot of people. They just don't know it's available.
It used to be available in Asda as well, but
right.
Again, possibly because it didn't sell very well because people didn't know what it was. They've got to actually go to the chemist and order it, and then the chemist will get a regular order, placed for. But
mind if somebody doesn't mind a little bit of mint, Sensodyne toothpaste's SLS free, which is the sodium lauryl sulfate, which causes the foaming. So Sensodyne will have that non-foaming action, but it'll still have a bit of mild mint. So it just depends on what you're looking for.
There's also, I think it's Aquafresh are doing a senses range, so that again they'll do different flavours so that it has an adult fluoride content, but like a nicer flavour.
Milder, because a lot of people
quite mild, yeah.
And you mentioned there that a lot of people just don't know that things like this are about. So where is the best place to find all this information? Is there one spot?
It's not really one spot.
It usually comes from us, to be honest, but we are just a small team in a large area.
We would always, if we do work in school or if we do work in a care home, we would always send a signposting sheet. So it would give you products, it would give you toothpaste, all that type of thing, and information so that they could, get the products a bit more.
Mind you, we are working, because it's train the trainer, and we do a lot of, it's MEC what we do, so making every
Yeah.
contact count. So if ever we tell the 0 to 19 team within our service, there's plenty, they would know that information to
Cascade
fill
down.
that information down for us. So
All right, okay. How important is it to visit the dentist?
yeah, obviously it's very important. The sooner a cavity is detected, it's making the job much smaller. If it gets left, it's just going to progress. I mean, tooth decay is not going to just disappear on its own. It would need to be treated.
From the other side of the coin is, an adult should go at least once a year, not just because of the sort of state of the teeth and the gums, but the dentist is also looking for mouth cancers as well. We're coming up to Mouth Cancer Action Month, which is in November, and we would do like a little campaign around Mouth Cancer Action Month. The dentist feels, you might have to put your tongue out, put it in different positions, and then he or she is looking for any kind of change in the mouth. So it might be a red patch, it might be a white patch, it could be an overgrowth of gum, and it looks similar. The white patches look a little bit similar to an ulcer. Now an ulcer will go away within 2 weeks, but mouth cancer obviously won't. So if someone says to you, oh, I've got this thing, I've had it in your mouth a month or so, we would immediately say go along to the dentist and get it checked out, because you could be saving somebody's life. It's like any cancer, early detection is the thing. If in doubt, get it checked out.
Nowadays, especially after COVID, it was well publicised that currently people are struggling to see dentists. Why is this? And as you mentioned there, if someone's got something that's possibly serious, will they be able to find a dentist?
So yeah, just accessing a dentist is very limited now. I think the majority of dentists are seeing a lot more private patients. The availability on the NHS has been cut right back. So this is just meaning that we are finding a lot of the groups that we're seeing, they're ringing up and there's just nobody taking on, or they're saying the waiting lists are a good couple of years long. So these patients are just sort of left without being able to access a dentist. So they're not really presenting with problems, or they're maybe presenting to the GPs instead. As well, if somebody's turning up at the dentist, a filling that would have been so small if they'd shown up every 6 months has then progressed into being a really large filling. They might need 3, 4 or 5 of those fillings that might have taken a dentist just 20 minutes to sort out pre-COVID. So it is the amount of work that the dentists are having to do.
It's put a big strain, hasn't it, on the NHS.
Does this make your roles even more important now?
Yes,
More
because
important,
if you can prevent it from happening in the first place by doing a lot of the work at home, i.e. brushing teeth, keeping shut at meal times, then in the long run it'll benefit the patient. The pilot that Emma was discussing before, about we're going into care homes and putting some fluoride on their teeth. Again, that's a form of prevention. So if that care home can't get a dentist to go in, at least, when the CQC go in, at least the see that the care home is trying to do something about it and prevent, further problems. Because applying fluoride varnish, it can actually stop a tooth from decaying any worse.
Arrest that decay. And also we're working along with the schools to implement toothbrushing programs within school. So allowing year groups to brush the teeth within school. So that's an extra time of day that would be brushing. So again, just to hopefully help with that strengthening using that fluoride.
That they'd feel more likely to do it.
Yeah, saying that peers doing it, some of them might only brush once a day at home, so that is their second time of day.
And if we're following kind of nice guidelines, it's last thing at night, that's the most important time. And just one other time during the day. So it doesn't really have to be morning and night, but as long as they're having that 2 blasts of fluoride twice a day, that's going to sort of benefit their teeth. Fluoride is a mineral, and our enamel is a mineral, and it soaks in and it strengthens. So it's good to get them into a routine, isn't it? You know, of getting that twice a day application.
We always say pop your toothpaste directly onto a dry toothbrush. Everyone's always shocked when they see your face and they're like, oh, I wet my toothbrush before and then I wet it again and then I put it in. You just
And then it goes down the hole.
you foam that toothpaste up quite a bit and you lose half of it. I mean, you're only using a pea-sized amount, so you don't want to lose all of that. So it's just brush your teeth. Then everyone's heard, I'm sure, in the dentist to spit out the toothpaste and don't rinse with water afterwards, just so that you're topically leaving that excess paste in your mouth for a little bit longer to work on your mouth there. But then everyone always asks about mouthwash straight after. Mouthwash hasn't got nowhere near the fluoride in that our toothpaste has, so you would just be washing off that fluoride to use a mouthwash directly after. So we'll say wait a little while after toothbrushing to use your mouthwash. If not, use it maybe that other time of day, maybe it's lunchtime when you're not going to be brushing.
And last thing at night is the important time, but you would wait at least a half hour before, you know, brushing your teeth after they've had some supper or a meal. You know, wait at least half an hour after, because obviously you'll be brushing the acids from whatever the food is, brushing it into the gums, into the teeth.
What can somebody do if they are struggling to find a dentist?
They could try 111.
111, yeah. That would be the out-of-hours service to see an emergency dentist.
The out-of-hours service covers every single holiday, including Christmas Day, Boxing Day, and they might have to travel a little bit to actually access that particular dentist. But if they're in pain, you know, at least they would be pain-free, get them out of that sort of painful period.
That brings us to the end of this episode. Thank you, Pauline and Emma, for joining me today.
Thank you, Harry.
Thank you. It's been good.
Thanks for joining us for this episode of Our People podcast. We hope you enjoyed it and check out our other stories. Hit subscribe to keep up with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.